Health equity is a moral issue. It affects the length and quality of our lives. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Senior Writer with AHA. In today's podcast, Duane Reynolds, President and CEO of the Institute for Diversity and Health Equity, and Priya Bathija, Vice President of the Value Initiative, discuss how hospitals and health system leaders are addressing the social determinants of health to make care more equitable. Let's join them.
Thanks, Tom. I'm here with Priya and Duane. Why is health equity morally important?
Sure, I can start. I think morality is somewhat relative, right? So, what may be moral to one person may not be moral to others. But as individuals working for the AHA and representing an organization that is involved in advancing health equity, we see this as a moral issue, one that all hospitals and health systems really have to solve. So from our perspective, that is really how we view it.
And I think a lot of the hospital leaders that we work with on a regular basis see it that way too. And I was fortunate enough to start my hospital career at ProMedica Health System in Toledo, Ohio. And I remember sitting in business and operations meetings with our CEO, Randy Ostra, and he would just say, well, we need to figure out how to do it because it's the right thing to do. And it didn't matter if we were talking about ensuring access to healthcare services for the community or addressing obesity in the region or whether we needed to be part of a community event. It was just a part of who he was and was a part of who ProMedica's boards and leaders are. And you can really see that now because a little over 10 years later, they really are an anchor for their community. And they're not only providing high quality healthcare, but they are addressing the social needs of their patients and social determinants for their entire community. So just as an example, they started screening patients for food insecurity. And now it's grown to the point where they screen around financial strain, utilities, training and employment, housing, behavioral health, transportation, and a number of other things. And then they act on that. And they have developed a series of programming to connect individuals with their needs so that they can ensure that they are healthy. We have leaders like Randy Ostra who are part of the healthcare delivery system who are really believe that this is morally important. And he's not the only one. We have examples in Boston, in California, in Texas, all over the country.
Yeah, I think we're finding that more and more. Most leaders in healthcare are in it because they understand that this is about people and we want to make our communities better. And we're getting smarter in understanding the connection between public health and our healthcare system and understanding that it takes the convergence of those two things to really be effective at driving health. And so I'm excited about this point at time at which we are because there are leaders that are really starting to engage around this. And I think that it's going to benefit our society.
That's great. So obviously so many leaders are engaging on this and addressing those determinants. But what implications does it have for our society if they don't?
Well, I think there are a couple of things that we can point to. First, it produces poor health. And we know that. We know that there are statistics out there. For instance, if we think about maternal mortality, from a disparities perspective, Black women are 3 to 4 times more likely to die during pregnancy, regardless of education, income, or any other socioeconomic factors. And that has a hindrance on the individual, but also on the broader community and society at large. Right? If people are suffering from these disparities, it means that they can't perhaps go to work. They can't adequately care for their families. They can't be productive members of society. And that has a toll on all of us at the end of the day.
Yeah, and I'll just build on that from a value initiative perspective where we are looking at value as costs, outcomes, and patient experience. And a lack of health equity really has an impact on all three of those parts of the value equation. So to go into some of the statistics around it, a lack of health equity can lead to higher healthcare costs. So researchers estimate that health disparities amount to approximately $93 billion in excess medical care costs. And then to build on what Duane said, they also could result in $42 billion in lost productivity per year. So there can be a significant cost associated with a lack of health equity. Then building on the fact that you said that, it leads to poorer health.
Yes.
When we address health equity, we start to see improvement in health outcomes. So the best example really is all the steps hospitals have taken to address readmissions. And most of those efforts are focused on addressing some of these things that are happening in an individual's day-to-day life that ends up impacting whether they come back to the hospital or not.
Yeah. I really see it as being a part of, to Priya's point, the value equation, right? Health equity helps to amplify the value equation. I recently learned of Baylor, Scott and White. They have created a community advocate program where they're recruiting students from undergraduate programs, local universities, and they're bringing them in to screen patients for social needs. And then they're connecting them with resources in the community. So they act as an extension of the clinical team. And they've screened over 1,600 patients. 80% of those patients, they identified social needs, and they were able to reduce their 30-day readmission rate by 87.5%. That is the business of healthcare, but it also advances health equity.
That's great. So those sound like some really promising efforts. Do you have any personal experiences that relate to the topic?
I do have an experience. I was, in my previous life, I was actually an administrator in faculty practice administration. And I had a physician who was just amazing. And she was very interested in developing a transgender clinic within our family medicine department. And so we worked really closely together. We worked with a community member, a prominent community member of the transgender population who helped us understand some of the nuances of what our staff would need to know, of what our registration folks would need to know. And we started having this clinic like once a week. Well, it grew to the point that her panel was oversubscribed. She started pulling primary care patients from different states. I mean, that just doesn't happen. Unfortunately, the system that we were at really wasn't ready to sort of open this up for primetime marketing. Though it was going to meet the needs of a very vulnerable patient population, it gave them a feeling of safety and comfort. And quite frankly, it could have also been a business advantage for this health system because they were recruiting in new patients. And with the transgender community, we think about not only their primary care needs, but then there's endocrinology needs. Then there's perhaps surgical needs. So if we thought about this in the context of a different type of care model, all of a sudden this could be a multidisciplinary clinic, and we missed that opportunity. So I think it's really important for organizations to begin to think about this in a different way. So that's one very personal anecdote that I had to share.
That's great. That's a really great story. And it just goes to show, that obviously, there is a business case for health equity, but so many of us are just doing it because it is the right thing to do. So anything else that either of you wanted to add?
Well, and I'll just say that, a lot of these things and programs that hospitals are taking on to address health equity are not things that they're currently getting paid for right now. So when they take it on, it is really because they want to be helping their community achieve health and well-being, and they want to make a difference and be a part of that community. And there's a lot of research and studies that show how hospitals are economic engines for their community, but we're not just taking, it is part of giving back to the community and working with the community to make it happen. So in a lot of situations where we're seeing hospitals address health equity, they're not doing it on their own. They are partnering with others in their communities, whether that be payers or community stakeholders, to come together to do it. And we're actually seeing a lot more hospitals partner with other hospitals and their competitors in their communities to actually make change. And I guess one of the best examples I've seen is actually here in Chicago with Westside United. Mm-hmm. And that has brought together, 6 hospitals on Chicago's West Side, along with civic leaders and healthcare professionals. And they've come together to address inequality in healthcare. And they're focused on 4 areas: education, economic vitality, healthcare, and the physical environment. And so they've come together to do a lot of great things, and it's all focused around boosting the life expectancy of the city's West Side. So right now, that is 69 years old, and it's 16 years less than the average life expectancy of Chicago's wealthiest neighborhoods. So they want to shrink that gap in half by 2030. And so they're doing it in a number of ways. So they're spurring economic growth by redirecting services to that community. So for example, they learned from the Cleveland Clinic model that's taking place now in Cleveland and have created a local hospital laundry service that will be staffed by up to 200 West Side residents. They're also supporting local business development through local purchasing, and they've invested $100,000 in small business accelerator loans and grants. They're investing in education. They are also investing in those community programs around health, and they're focused in areas like maternal and child health, childhood asthma, and hypertension. So we're seeing them come together with community partners on a variety of different ways in which they can improve health equity and ultimately improve life expectancy and the health of their communities.
Yeah, I think that's a really important point. And I want to bring up that the distinction between healthcare equity and health equity. Mm-hmm. So healthcare equity is about insurance status, about access, and about the administration of healthcare services. And typically, a hospital can focus on those things more easily. But health equity is really about an outcome based off of an individual's opportunity to achieve their highest level of health. So that's how we tie into the social determinants and understanding how social determinants are distributed in different ways across different zip codes. And so people's opportunity to achieve maximal health is inhibited by just living in a certain zip code. But really, the convergence of those two things, healthcare equity and health equity, are what are going to solve the health equity issues. And hospitals have to partner. We can't take it on all of ourselves. And we don't always have the answers, right? Community-based organizations may have deeper relationships and trust with community members. They likely have solutions to food insecurity or transportation. So it means that we have to take on a very different relationship than perhaps we have played in the past with these community partnerships. And Chicago's Westside United is a perfect example.
So, Duane, speaking of social determinants, is there a link between social determinants and the demographic shift?
Well, what we know is that the majority of American cities at this point are majority minority, and the demographics are continuing to shift. And so ultimately, we have to have a reframing of our healthcare system so that we are much more culturally nuanced in how we address racial, ethnic, language issues, and other cultural equities that are really important for us to be successful as we move forward under value-based care and population health.
Duane, thank you for that. Thanks for coming. Priya, thank you for joining us.
Yeah, thanks for having us.
Absolutely. Love to have the conversation.
Thank you. I'm Genevieve Dicing, and thanks for listening.
Watch for future blogs from Priya and Duane on how inclusive care ultimately impacts quality, finances, and the patient experience. This has been Advancing Health, a podcast from the American Hospital Association. Thanks for listening.